Thanks very much, everyone, for joining us here this morning. Before I begin the COVID update, can I just once again thank our police officers, all our emergency services workers, all of our analysts here in Perth for all their efforts to find little Cleo over the last 3 weeks. It's been a magnificent effort, and the outcome, as we saw, was a wonderful result. So I think every West Australian has a spring in their step with happiness that whole series of events resulted in the finding of little Cleo alive and well. So terrific outcome, and I'd once again like to thank everyone who was involved. Overnight, West Australian Health has reported no new COVID-19 cases in WA. Currently, our vaccination rate for those aged 12 and older is 79.3% first dose, and 63.7% for people having had 2 doses. Today is a significant day for Western Australia. It's the day we announce our safe transition plan to ease our control border and provide a soft landing out of the pandemic. We all know COVID is as unpredictable as it is tragic. We're all aware of the death and misery it has caused around Australia and throughout the world. That is why our approach towards a safe transition plan hasn't been rushed. It's been careful, methodical, and thorough. The most important thing is it is a cautious and safe plan based on our expert health advice. The aim is to provide certainty for Western Australians, to provide certainty on how business and our unique way of life can continue safely once we further ease our controlled borders and minimise any impact the inevitable arrival of the virus may have on our state in the short, medium and long terms. Our transition is a world first. What's unique about our plan is that it's intended for border controls to ease at a point where there is no community transmission in Western Australia, combined with very, very high levels of vaccination. This puts us in the best possible position to transition with minimal impact on our health, our economy and our way of life. We have done so well, we do not want to fall at the last hurdle. The plan will take effect when Western Australia reaches a 90% double dose vaccination rate for people aged 12 and above. That is forecast to take place in late January or early February. But as we have announced previously, we will announce the specific transition day after we've achieved a double dose vaccination rate of 80%. That's expected to be reached in December. As far as the world standards go, a rate of 90% will be an amazing achievement. But I've always believed we can strive high and get the best result for our state. And given our current vaccination rates, these targets are realistic and within our sights. Our current vaccination rates are in line with the supply of the vaccine, and a credit to each and every West Australian who has rolled up and done the right thing, even without the threat of COVID-19 in the local community, as some other jurisdictions have had. I want to stress the 90% target threshold could be reached earlier or later, but once we hit 80% and then set the specific date for transition, that date will be locked in to provide everyone with the certainty they need to plan ahead and be prepared for the next stage of this pandemic. Now, it is a statewide vaccination rate. However, if there are regional areas that don't have a high enough vaccination rate, then pending health advice at that time, intra-state borders to protect those specific regions may need to be introduced. This measure would be in place until the vaccination rate in those regions is lifted to satisfactory levels. Cutting off the Pilbara, or any region for that matter, is not something I want to do. But if that's what is required to protect the local community and local industries, then we will take that step based on the health advice at the time. So I'd again encourage all eligible West Australians all over WA to get vaccinated. The sooner you get vaccinated, the sooner the safe transition plan can kick in. It's in your hands. So roll up for WA now before it's too late. Today's announcement has come after extensive modelling was undertaken to give us an indication of what kind of impact the virus could have here in WA and help inform our final decisions. That modelling, which assumes a realistic or medium level of testing, tracing, isolation and quarantine, known as TTIQ, suggests there are undeniable benefits in waiting until our double dose vaccination rate hits 90%. Put simply, if we eased our borders earlier at 80%, modelling suggests widespread community transmission would result in far more infections, hospitalisations and deaths. Instead, waiting for our vaccination rate to hit 90% double dose would mean that when the state reaches widespread community transmission, the number of general ward beds that would be occupied are reduced by 70%. ICU beds that would be occupied are reduced by 75%. And the cumulative number of deaths is reduced by 63%. The difference in easing border controls at 90% rather than 80% is 200 West Australian lives are saved. I repeat, the difference in easing border controls at 90% rather than 80% is 200 West Australian lives are saved. A comprehensive summary of the modelling will be released and available online shortly. But even at the most basic level, the differences are stark. They cannot be ignored, nor can the benefits. The modelling is not an exact prediction of the future, but the numbers cannot be overlooked. It reinforces our careful and cautious approach and our strategy to avoid unnecessary risks. We want to give Western Australia, the best chance of safely dealing with the return of the virus and its potential spread through the community. Saving lives, protecting our communities, our businesses and WA jobs is, and always will be, this government's focus. We won't be swayed and we won't be pressured into a different approach. We will follow the path we have set out based on our health advice to keep Western Australia safe and strong. Our island within an island has delivered health and economic results that have been the envy in the world and the best in the world. And with a safe transition, we have the potential to keep it that way. In order to ease our controlled border when we hit our 90% double dose vaccination target, specific safeguards will be required to minimise the impact of the virus. With a 90% rate and zero COVID in the community at the point of transition, Western Australia is in the enviable position to have minimal restrictions in place. This is the added benefit of a 90% rate and no community transmission of the virus. Based on our current health advice, the following baseline public health and social measures will be implemented at the point of transition in late January or early February. Face masks will be required, but only at high-risk indoor settings. These include on public transport, in hospitals and aged care facilities. Proof of vaccination will be required to attend nightclubs, the casino, and large events with crowds of more than 1,000 people, like the footy or a concert. Contact registers and use of Safe WA will still be required at all public venues, as will revised COVID event and safety plans, and entry will be restricted to remote Aboriginal communities where necessary. These safeguards will complement our vaccination rollout. They will be interim, they won't last forever, but they will put us in the best position in case of an outbreak. Our baseline public health and social measures are critical levers that will be able to be strengthened if the threat changes. The step-up measures, which would only be implemented on health advice, could include things like greater use of face masks, capacity and density limits on businesses and venues, additional proof of vaccination requirements, and rapid testing at workplaces. These step-up measures are something I want to avoid, and achieving a rate of 90% gives us the best chance of doing just that. These safeguards, together with a 90% vaccination rate, will enable us to ease our border controls, both the interstate and international border. At the point of transition, travel will be permitted from all jurisdictions across Australia. Arrivals from interstate will be required to be double dose vaccinated, return a negative PCR test 72 hours prior to departure, and undertake a test within 48 hours of entering WA. All arrivals from overseas will be required to return a negative PCR test 72 hours prior to departure and undertake a test within 48 hours of arrival. International arrivals won't be subject to quarantine if they're double dose vaccinated, but international arrivals who are not double dose vaccinated will be required to complete 14 days quarantine in a designated facility. All arrivals will be required to complete a G2G pass with the relevant evidence included. The border controls and G2G pass requirements will be reviewed regularly and phased out when appropriate, based on the health advice at the time. I understand there will be disappointment for some. I acknowledge some people will be frustrated. They may not be able to be reunited with family from New South Wales or Victoria over Christmas. I know what that feels like. I understand. I won't be able to see my parents and my brother until the transition in late January or early February. But as difficult as it is for the right reasons. It's about following the health advice and keeping Western Australia safe. We need to achieve the 90% vaccination rate to safely make the transition. This will ensure we can save hundreds of WA lives. It will ensure we can make longer term plans with certainty. Western Australia has done such a great job, we don't want to fall over at the final hurdle. The next step is coming. After nearly 2 years, we're on the verge of a new chapter. A chapter that will reconnect Western Australia with the rest of the world, but done the right way. The West Australian way, safely, carefully and responsibly. To rush it increases risk and increases harm. That's why our Safe Transition Plan has been carefully calibrated based on extensive modelling and the most up-to-date health advice. It is about safety, it is about certainty, it is about providing a soft landing out of the pandemic that reduces the risk and consequently the threat to our enviable way of life here in WA. Something we've done so well to achieve by coming together for a common goal. The goal is now within reach. We just all need to get vaccinated. I'll take questions in a moment, but now I'll hand over to the Health Minister.
Thank you very much, Premier, and good morning, everyone. I'd like to dedicate this morning to some comments around vaccination, but before we do that, I have an update for travellers from the Northern Territory in Queensland. The Northern Territory is reporting that an unvaccinated contract worker in his 20s has been diagnosed with COVID-19 in Katherine, with no recent travel or known exposure. Katherine and parts of Greater Darwin are being locked down for 3 days. Queensland is also reporting 2 separate infections, one in a truck driver who entered Queensland and then flew out to Victoria, and the second in a group of young women in Goondiwindi who attended various events in Moree in New South Wales, where there is now a significant outbreak in the Aboriginal community there. Effective immediately, anyone who has been at the listed exposure sites between the specified time in Queensland or Northern Territory are required to self-quarantine for 14 days and be tested immediately within 48 hours and at day 12. And the list of exposure sites are on the Healthy WA website. WA residents returning from Darwin, Katherine, Brisbane or Goondiwindi areas who are experiencing any symptoms, even mild, that could be related to COVID-19 should get tested and isolate until they return a negative test. This just shows how quickly COVID-19 can break out, even in somewhere like the Northern Territory, which has been free from community transmission for many months. Now, just to vaccinations and today's announcement. Everything you have heard this morning reinforces one thing: to get vaccinated. I'll say it again, to anyone who is watching or listening this morning, get yourself vaccinated. about 1.75 million Western Australians have had their first dose. That's 80% of the population over 12. But to get to 90%, we need 2 million people to be vaccinated. To get to 2 million, we need at least 250,000 more Western Australians to roll up and get vaccinated. That's about 4 Optus stadiums full of people, and we can do it. Do you really want to be one of those 250,000 people holding us back by not taking the next big leap and getting yourself vaccinated? The time for hesitation or procrastination is over. Just get on with it. But 1 dose is not enough. You need 2 doses. So here's a quick rundown of where we're at in WA by age group. We've reached 90% double vaccination for Western Australians aged 70 and over. So a big double vax gold star for all the Western Australians 70 and over. If you're aged between 50 and 70, about 80% of you are fully vaxxed. So no gold star, but almost at the 90% mark. If you're in your 40s, this group is at 70% fully vaccinated, so there's more work to be done. Now, to the 20s and 30-somethings. I remember what it was like. It seems like you've got all the time in the world and you're having a great time. I know you plan to get vaccinated, but you probably just haven't got round to it yet. Well, it's time to get moving. Only 45% of those, just under 60% of people aged in their 30s have been fully vaccinated, and only 45% of those in their 20s are fully vaccinated. So if you're in your 20s or 30s and you're watching this today, it's time to roll up for WA. Tell your friends, tell your mates, tell your brother, tell your sister. Go and get vaccinated now. Do you really want your lifestyle to be cramped just because you couldn't bother to get vaccinated? Of course you don't. So don't hold everyone back. Don't hold yourselves back. Get vaccinated. So just to repeat it again, we need 2 million Western Australians double dose vaccinated to reach 90%. And at the moment, 1.75 million have had 1 dose and 1.4 million have had 2 doses. So we need 250,000 to get their first dose and 600,000 more 2 doses. And what better time to do it than tomorrow at what we're calling Super Vax Weekend. This weekend, there are all sorts of different places you can get vaccinated, even at Bunnings. Yes, you can get a sausage on a bun for charity and get yourself vaccinated and roll up for WA. There will be pop-up clinics at 8 Bunnings stores this weekend. Rockingham, Harrisdale, Mindarie, Balcatta, Cannington, Ellenbrook, Geraldton and Busselton. No bookings are needed, but there are also lots of other options at state-run clinics this weekend. Thousands of people will be attending Diwali Festival at Claremont Showgrounds this weekend, so the clinic there will be expanding its hours to cater for anyone attending the festival who want to take advantage of that clinic. A new clinic is opening today in Mandurah. It will be open during the weekend. There is also a new clinic opening at Canning Vale Market City from tomorrow, and during the weekend there will be clinics opened at Carramar Village Shopping Centre, Centre Point Midland, Kwinana Super Centre, Lakeside Joondalup, Perth Convention Centre and the Square at Mirrabooka. And outside of Perth, there will be clinics open at various times during the next week, including in Bunbury, Busselton, Collie, Manjimup, Margaret River, Yarloop in the southwest and Albany in the Great Southern. Boddington, Cunderdin, Corder, Lake Grace and Northam in the Wheatbelt, Kalgoorlie, Coolgardie, Kambalda, Laverton and Leonora in the Goldfields. Exmouth, Geraldton, Kalbarri, Mullawa and tomorrow at Morawa in the Midwest. And next week there will also be clinics open at Headland, Karratha and Onslow in the Pilbara. Broome, Derby and Wyndham in the Kimberley will also be having clinics. Details will be on the Healthy WA website, so please check and get yourself vaccinated. But these are just the state-run clinics. So about half of all vaccinations take place in the state clinics. The other half are done through the extensive network of GPs, respiratory clinics and pharmacies. So check the Healthy WA website for all the details. Getting yourself vaccinated is free. It has never been easier, and the clock is ticking fast if we want to get to 90%. So roll up for Supervax weekend, roll up for WA. Back to the Premier.
Premier, 90% is a very high number. Some experts say that we won't reach that. If we don't reach 90%, does it follow that we don't open up?
What will happen is this. First half of December, we'll be able to set the exact date. It'll be sometime in late January, early February. And we'll get better line of sight on that because sometime in the first half of December, we'll hit 80% double dose vaccination and we'll know exactly when, or we think we will know exactly when we will hit the 90% double dose vaccination rate. That will allow us to open up to New South Wales and Victoria and the ACT. Also allow us to open international borders subject to all those restrictions I put in place before. Once we set that date, it will be locked in. It will be locked in. But if we don't, on that date, reach the 90% double dose vaccination, that means there'll be further public health social measures put in place. So that would mean restrictions on venues, restrictions on workplaces, restrictions when it comes to masks, all those sorts of things that we're desperately trying to avoid. But that would be around that date. The exact day, I can't tell you at this point in time because we don't have that with exact precision. But we'll get precision on that in the first half of December.
And how do you think the public will react to this, knowing that they could be punished going through till the end of February, into March, because of a few scragglers that won't do the right thing?
I just say to people, go and get vaccinated. Please go and get vaccinated. The time for protest, the time for carry on, the time for reading crazy conspiracy theories is over. Go and get vaccinated, save your life, save your family's life, and do the right thing by the community.
Why punish 80% of the state who have done the right thing because of a small minority who have had ample time to get vaccinated already?
Every state is setting its rules, and getting to high levels of vaccination prevents people dying. So, you know, we've got to actually take account of that. We're giving people ample time to get vaccinated, and the time frame is set now, and I just urge people to do the right thing. I mean, in terms of how we've done as a state, I mean, if you want to look at states who have been through a torrid time, go and have a look at Victoria and New South Wales. Our performance has been stellar by comparison, and you know, under this model, the model we've adopted, we'll have a very, very normal Christmas, a very normal Christmas holidays. Won't have all the restrictions that Queensland and South Australia and Tasmania and New South Wales and Victoria are going to have in place, and we'll get to that 90% high vaccination level when we can transition with some very modest public health social measures that are put in place. And we think this is the right approach. We think this will work, and it'll provide the opportunity for people to travel interstate or overseas at that point in time.
It might sound harsh, but is it as simple as Is it as simple as just to save 200 lives? The difference between 80% and 90%? Is if you distilled it down, is it just those 200 lives?
That's what the modelling shows. You know, we have to rely. You know, we get given modelling by health professionals who are experts at these things, and it shows there is 200 people who could die or would die if we open too early. So that's the difference. So I don't want that on my conscience. Hold on. I don't want that on my conscience. I want to make sure that we get through this without that occurring, and also all of the other people getting sick, because lots more people get sick and lots more people have to go to hospital, lots more people have debilitating impacts if we don't wait to the 90% mark. So look, our approach is unique. Other states are sort of putting in place measures to open, if you like, at the 80% double dose vaccination mark, but the consequence of doing that is there'll be more people sick, there'll be more people very unwell, more people potentially die, and they're putting in place a whole range of restrictions on their community over Christmas and over the Christmas holidays that will be very debilitating for those states. So that's the choice we face, and I think we've made the right choice to keep our states safe, to have the best health and economic outcomes.
Are those 200 people and the other people that you keep saying will get sick and possibly die, are they vaccinated or unvaccinated?
I'll let the health minister answer that, but predominantly unvaccinated.
So if they're unvaccinated, then this is going to happen anyway. at some point?
No. When we get to the 90% mark, no. When we get to the 90% mark, obviously there's a large number of additional people vaccinated, and the modelling shows that we can reduce the death and mayhem and health impacts across the community.
So essentially we've thrown out the national plan. The national plan's to open up at 80%. We've thrown that out and you're just rewriting the rules just for WA.
Hold on. New South Wales and Victoria have done completely different things to the national plan over the course of the last 3 months. Completely different. They've ignored every agreement that was put in place. The Commonwealth has accepted that in the case of New South Wales and Victoria. They've opened up internationally when the agreement wasn't that would happen. So New South Wales and Victoria have done that because it met their individual needs based upon the circumstances they face. Now our circumstances are different to theirs. We don't have community spread. We don't have scores of people dying. We don't have hospitals in the condition theirs are in because of COVID patients. So obviously our circumstance is different. You know, I'm not going to adhere to some, you know, set of rules that's going to result in 200 people dying just because some people say I should adhere to rules that New South Wales and Victoria haven't. So we're just going to do the right thing by the people of Western Australia, by the state, by the economy, by the health of people, particularly older West Australians, in the interest of the entire community of Western Australia. And I think, you know, if the other states had the choice that we have, they'd do exactly the same thing. If they had our choice, because we don't have COVID and we have the benefits of isolation, we have the benefits of borders, they do exactly the same thing as we are.
But some of them do have the choice. They're COVID-free. South Australia, for example, and they've taken a very different model, which is harsher restrictions before Christmas to reopen borders. They've made that choice.
Yeah.
So they are not doing what you're suggesting.
That's right. New South Wales and Victoria had our choice, they would. But South Australia and Tasmania and Queensland have made a different choice, just so people understand what that is. In South Australia, there's going to be restrictions in all sorts of venues, 2 square metre rules put in place in all sorts of venues across the state, whether it's pubs, restaurants, bars, hospitality, cafes and the like. They're going to have restrictions on how many people can come to your home. They're going to have broad-ranging mask wearing over the Christmas period. And obviously, they're going to have a much greater health threat than we have. Now, I don't want to do that. You know, that's the choice we face. I don't want that. I don't think most people here do want that. But the price of that is we wait a little bit longer and we get to the 90% vaccination mark.
Can you explain the zero COVID caveat? How do things play out if it does manage to sneak in?
Well then, if COVID comes in, so obviously it's got into the Northern Territory now, it's got into Queensland. The Health Minister outlined our approach to those jurisdictions. If it comes in, obviously we'll have to deal with those circumstances. But if it comes in, the potential is there at this point in time for some form of restrictions and some form of lockdowns being put in place. That's why we want to avoid that.
At what point does that threat of lockdown end? At what vaccination threshold?
Well, obviously at 90%, with the exception of communities that might have low levels of vaccination. So, at this point in time, Aboriginal communities have very low levels of vaccination. The chances are that at the 90% rate, which we will hit late January, early February, we will have to have restrictions on who can come into and come out of Aboriginal communities, and that will be put in place across the state. The other thing is some regions. So, for instance, the Pilbara is currently at 45% first dose. 45% first dose, very low. If they don't get their rate of vaccination up before the transition takes place, we're going to have to put in place rules around the Pilbara. So who can come in and come out? And those people who are double dose vaccinated will be able to come in and come out. Those people who aren't won't be able to. So that's the sort of decisions we're going to have to make. So that's why I'm saying in those regions, particularly the Pilbara, please go and get vaccinated now.
How long is that likely to be cut off for if they're not going to ever reach that target? How long is it going to stay?
It'll be based on health advice, but I suspect these sorts of decisions we have to make will mean that people go and get vaccinated.
Did you speak to Perth Airport about the plan? Because I gather, you know, given they just posted $75 million of loss and there's no real end in sight in the next coming couple of months, I mean, how would they react to this, do you think?
Oh, look, I speak to them all the time, but not specifically about this. Look, at the end of the day, Western Australia has been the shining light when it comes to aviation. Just so you know, for the major airlines, the shining light of Australia, because we kept our internal economy open and the FIFO industry continued without any interruption. So it's been the one thing above all others that has kept the airlines afloat. So look, waiting till the 90% mark, I think, is the common sense and sensible thing to do. I'm sure Perth Airport and the airlines will understand.
How do
The
you
new
envisage?
hospital beds that you announced, will they be established by late January, early February?
Some will be, but obviously cases grow over time. So at the point in time in late January, early February, obviously cases grow over time, and the peak you push out as far as you can, so it's flattened, flatten the curve. So the beds come on stream over time.
The workforce that a lot of industry is screaming out for, fill a lot of vacancies, international students, how's that going to play out?
Oh, well, that'll be next year, and we'll work out individual plans. So we'll have roundtables with these industries, tourism, international conventions, international students. We'll have roundtables with them. We'll provide support for that and for those industries to get them back on their feet. So all of that process will be undergone over coming months, and we'll do it in a methodical, sensible, reasonable way. But we want to get back to all those industries thriving as they did before COVID.
With children, 5 to 11-year-olds, will you rule out including them in the 90% if they're approved between now and then?
Yeah, no, they won't be included in the 90%. Obviously, our figures are 12 and above, which, by the way, is the I suppose the strongest measure any state in Australia is using. The others are using the 16 and above measure. We're using the 12 and above measure. So our measure, we're putting the toughest, I suppose, the toughest requirement on ourselves of any state in Australia, because that's the safest thing to do.
Unlike every other state leader, you're not offering a firm date. Why not? And then secondly, when is the peak in hospitalisations expected?
Look, we'll table the modelling later on today, but the peak in hospitalisations all depends upon what public health social measures you put in place. So that's all mask wearing, restrictions and all that. When we first open up, late January, early February, the public health safety measures will be very modest. So mask wearing when you go into a hospital or an aged care facility or you're catching a train or a bus. Very modest, some restrictions on basically only vaccinated people will be able to go to nightclubs or to major events and the casino. So, those places will be places only vaccinated people can go to, because the people who run them can easily check who is vaccinated and who is not. So that measure will be put in place. Then if you want to go east on holidays, you have to be double dose vaccinated. So there's another incentive. If you want to go to see family or whatever in any other state, you need to be double dose vaccinated. So all those rules will be put in place. We haven't set an exact day because, as we have said the whole way along, we'll wait to the 80% mark, which we'll get to in December, so we know exactly when the prediction is we'll get to 90%. It gives you far greater certainty. So, but we know it'll be late January, early February.
Does this put an end to the fifth test due in January 14th? Under these circumstances, it couldn't go ahead, could it?
No, I understand the police and the health officials are working with Cricket Australia on all of those matters, and we've conducted sport for the last 2 years, whether it's both types of football, whether it's cricket, whether it's basketball, whether it's netball. All of those things have happened over the course of the last 2 years, subject to rules and bubbles. So that's something that will be worked on jointly, and I'm very confident there'll be a good outcome reached. But I'll just say this, we held the grand final, the AFL grand final, the best one I think, in history, recently in Western Australia, because we were kept safe, and we did it with good COVID rules. So I'm sure we'll be able to hold further sporting events.
So what are you going to relax the quarantine requirements for cricketers, basketball teams, soccer teams? Because we're potentially looking at a summer of no sport in WA at the moment.
No, over the last 2 years, police and health have put in place rules that require various forms of quarantine and bubbles and all that sort of thing for sporting teams coming from elsewhere, and we've done it consistently and allowed all the sporting codes to operate in a COVID-safe way, and we have not had a single outbreak. So those sorts of measures have been put in place before. I'm sure we can manage it again.
I don't mean to labour the point, but I think it's only a few days after the fourth test that that test is due to take place here. I mean, there's plenty of states that want to pick that test off us. Yeah. That's a danger, isn't it?
It's been worked through by health officials, the police and Cricket Australia. As I've said repeatedly, sport is not my number one priority, but if we can do it safely, we will.
Excuse me for doing this, but social media, some of the comments already are, who's he kidding? We won't hit 90%.
Yeah, look, my advice to you is not read the comments, Gary.
Well, but they're people. They're just people reacting to what they're hearing here today.
There's lots of,
and you've got lots of followers on social media, Premier. And they're saying, who's he kidding?
Am I right to go?
Yeah.
My advice to you is that, lots of people say lots of things. I saw some things written about poor little Cleo's parents the other day. I'd ignore a lot of that commentary. We're doing the right thing by the people of the state.
Just on the hospital funding, the AMA's reaction was, we welcome this, but we were asking for this a year ago. So why only announce this now?
We announced in the budget $1.9 billion of additional hospital spend on recurrent services, doctors, nurses and the like, plus $3 billion of capital works, a total of $5 billion of improvements in the hospitals, the biggest package in the history of the state, and we're doing more as part of our response to COVID. So, look, I just would urge the AMA to be a bit positive.
But the AMA did say at the time they didn't think that was enough, and they were right, because you're spending more now.
As I said day before yesterday at RPH, we need to be methodical and thorough in what we do. So we work through what the requirements are based upon the modelling that is put in place, and we put our decisions in place based upon that advice we receive, and that's what we did the other day.
Can I just clarify? So you get to December when you expect it'll be 80%, and you set a date, and if that, regardless of whether you get to that 90%, on that date, you still will open up, right? You won't go. That'll be set, but there'll be additional additional restrictions if you have to open up below that 90%. That's correct, isn't
Correct. That's exactly correct.
Have you got any more tools in the chest to get people to get vaccinated? Because you've mandated, so that one's done. You're urging people all the time. Is there anything else you can do?
Well, we're doing a lot. I mean, we've mandated 75% of the workforce. We've provided clinics all over the state. We're putting one in Diwali on the weekend. We've got them in Bunnings all over the weekend. We've got them in Bunnings regularly. We're having a super vax weekend. Gives you the opportunity to go and get vaccinated. We're putting them all over regional WA. You can go to your GP, you can go to your pharmacist, you can go to one of the clinics, the community clinics, the Bunnings clinics. There's numerous opportunities to get vaccinated. Everyone is eligible for Pfizer. You can go to the pharmacy, you can get Moderna. The mandates, the vaccine mandates obviously have been controversial with some people. I'd just urge people to accept and move on now, because we need to get everyone vaccinated. I mean, apart from grabbing people, holding them down and vaccinating them, there's not much more we can do.
Why do you think it's still lagging then, especially in the regions? You've done all these. Why is it still lagging?
We're very similar to Queensland's rate, about 1 or 2% behind South Australia's rate, and a little bit in front of the Northern Territory. Now, Victoria and New South Wales have higher rates of vaccination because they got hundreds and hundreds of thousands of extra doses of Pfizer months before anyone else on a per capita basis. Now, that was understandable because they had huge outbreaks. And the fact they had huge outbreaks meant people were prepared to go and get vaccinated. Now, I've seen some commentators in the East saying we should have outbreaks here and that will get people vaccinated. Well, no, not doing that. We're just going to get people vaccinated as quickly as we can. We're setting a date, and people need to understand they need to get vaccinated as soon as they can.
Premier, there was I'm not sure, and you talk about the people holding us back. Apparently some member of staff from Duma House was attacked in the car park this morning by anti-vax protesters. Have you heard about that?
I don't know about that, but it does not surprise me. It does not surprise me. Some of the behaviour of the anti-vax protesters, threatening people with death and destruction and being bombed and attacked and killed, is outrageous. It's outrageous conduct. It's uncivilised conduct. And I just say to them to stop and go and get vaccinated, save your own life, save your family's life, and act like a grown-up.
Why not reward people who are double dose vaccinated for doing the right thing by allowing them to travel interstate?
Because they can still transmit. So that's the reason. So the biggest reward for getting vaccinated is it will save your life and your family's life, so it's pretty good incentive if you ask me.
What will the quarantine requirements at 90% when we reopen for people who catch COVID or are contacts of someone with the virus? what is the extent of furloughing going to be in Western Australia?
I might get the others to comment on that. I'm not sure. Look, the thing about getting to 90% double dose vaccination is a lot of those things are removed. You know, furloughing is a big issue in Victoria and New South Wales, and just so people understand what it is, it means lots of people are stood down because someone in the workforce gets COVID. If you have workforces where 100% double dose vaccination, which will be 70%, 75% of the workforce we expect, well then it avoids a lot of those problems. So that's the aim, so the critical industries, people who work with vulnerable people are protected, and the people they work with are protected.
Are you disappointed that young adults are still taking their time in Western Australia when it comes to vaccination?
I just urge everyone to go and get vaccinated. Everyone. You know, young adults, to be fair, didn't get the opportunity to get vaccinated till months behind people who are a bit older. So you've got to remember the process. When the vaccination first rolled out, certain people were eligible based upon, you know, their medical condition, where they worked and how old they were. Younger adults have only had the opportunity to get vaccinated for less than half the time of older people. So it's understandable that there's a sort of a catch-up. But, you know, now I just say to everyone, there's bookings available. You don't even have to book. You can walk into any of our clinics, you can make an appointment at a pharmacy or a doctor, and you can go and get vaccinated now. Please do so.
Father, what do you make of your trip to Carnarvon? What do you make of your brief trip to Carnarvon yesterday? What's your overall feeling?
It was a very uplifting experience. I really liked the police officers. They were great people. The Commissioner ushered me into a room, and there was about 60 men and women standing there in suits. Very foreboding looking group of people that he then invited me to speak to. But they were determined and committed, and they did a wonderful job. And everyone I spoke to was nice and knockabout, but had a sort of an underlying professionalism you could feel. When I went to the house and I met Cleo and her family, they were just lovely, kind people. They were positive. They were positive, and they were happy. Their daughter had been brought home, and she was a happy little girl, and that was lovely.
The modelling has now been released by the department. Shows the peak in hospitalisations looks like it'll be about 250 to 300 days after community transmission is established. Obviously that means we're going to be living with illness and restrictions for months. How different do you think life is going to be in WA next year?
Well, we've been through it before. We've been through it on 3-4 occasions before where we've had measures in place. What we want to do is keep the infection rate low, have the vaccination rate high, so that we can have minimal restrictions in place. And what we're trying to avoid is putting those restrictions in place over Christmas, New Year's and the Christmas holidays this year. But if we do it right, we can have a very soft landing. This whole thing is like trying to land a plane. The most dangerous time in flight is when you're trying to land the plane. And landing the plane is something we're trying to do with a minimal disruption, minimal sickness and death, and we certainly don't want to crash. And we're now towards the very end of the process of reopening the state to the other states and to the world. We don't want to make a mess of it and crash and fall at the last hurdle, and so that's what all of this is about.
Have you spoken to the Prime Minister about it at this stage?
No. I'll see him. I'll talk to him today. Thank you.
The Commissioner.
Chief Commissioner.
Police Commissioner.
Getting the order right here.
No
can
pressure.
Can I
Yes,
make
go
a
on.
couple of comments first on a couple of matters that have been made? Look, we've largely got here to date because people have done the right thing, but I am concerned about a couple of things which I just want to mention before answering further questions. The community of Western Australia came on board and I asked police, for instance, to hand out masks rather than hand out fines, and we saw a really good community uptake. And we can be delighted that we've got 80% of the population at first dose, probably by tomorrow. And after the uplifting events in Carnarvon this week with the rescue of Cleo, yesterday I flew to the Kimberley and spoke to the Kimberley Land Council, who are very supportive of vaccines. But let me give you a few stats, because the vaccination rates for our Aboriginal people really concern me, and they should concern all West Australians, and we need to change it. While the rate of the entire West Australian population, as I say, is about 80% for first dose, For Aboriginal people, in the Kimberley, 38% of Aboriginal people have received their first dose, and only 1 in 4, 25% in the Kimberley, are presently fully vaccinated. The Premier mentioned the Pilbara, 26%, that's 1 in 4 Aboriginal people across the Pilbara have got their first dose, but only 13%, just over 1 in 10, are presently vaccinated. That's why we have to be very careful with this. We don't want this disease to devastate those communities, because not only will they be very vulnerable, people will die. And so the message I gave to the KLC AGM yesterday is this is coming, and we will have to restrict your communities if you don't get vaccinated. We will have to reinforce the emergency management directions. So that's why we don't want to penalise people, and I'm very concerned about that, because there's a lot of misinformation amongst those people. Some people are telling lies, and the superstition and the procrastination, look, it's not going to come here. It will come there if we don't put the proper measures in place, and the best measure is to be vaccinated. So people might think that I'm speaking alarmist. I'm not. We've got excellent health advice. We've seen what's happened in other jurisdictions, not only in Australia but around the world. So I just want to put that out there first, and I'm happy to take further questions.
Commissioner, that sounds like you've got, with all due respect, absolutely no chance of getting 90% in the Pilbara and the Kimberley. So what's the future look like?
Well, I'm confident that the state can get to 90%, but I'm not confident in those very vulnerable Aboriginal communities. So while the broader population, I'm very confident we'll get to 80%, mid-November. But beyond that, as has already been said, that last 10% is going to be tough. I'm presently not confident with some of those Aboriginal communities. So that's where we've got specific programs being put in place. We've got to work hard with this, door to door, literally. That's going to take some extra time, and I'd forecast that we'll have to put some very strict boundaries in place there.
Because obviously, you talk about the Kimberley being one of our tourism meccas, so if we start to look at normality in most parts of the state, but it sounds like you're going to have to cut off those areas for many, many months to come.
That's what's ahead of us. I imagine that Perth and the greater part of the southwest will achieve, I think, what is being forecast. But I'm bluntly saying there are certain parts of the state, unless something changes, there will almost without doubt be restrictions for certain areas.
Are you expecting a different climate for your officers now that we're getting to sort of the end stage, if you like? In the early days, as you said, they were handing out masks and fines, but now we're dealing with a lot of hard nuts, people who say, well, I've been double vaccinated, but I'm not going to wear a mask. Do you have to take a different approach now just to get everyone over the line?
We've got to protect the majority, and the majority are coming with us on this. There's no doubt there's people outside of this building who are rusted on in their particular ideology. We cannot listen to an ill-informed minority because we have to protect the greater population. This is not a populist approach, it's based on the public health advice.
Will the Ashes test go ahead under the current fixturing and dates?
The Premier's already answered that. I've got nothing further to add what he's already said.
Well, what needs to change? Because everything we're hearing is that it's engraved out, as are other sports events this summer.
The AFL didn't hold the grand final here because we couldn't manage sporting events. We were chosen because WA has handled major sporting events superbly. And so that can happen again. I've got no doubt that can happen. So we've been demonstrating throughout the last 18 months a capacity to run games in quarantine if necessary, but we've also had the highest attended open sporting events. So there's no reason that cannot proceed.
But it's quarantine that seems to be the issue, the short time between the 4th test and the 5th test. I mean, you're going to have to make some tough calls there about whether you're going to drop quarantine requirements, are you not?
Well, you've heard the Premier's comment. It's not the highest priority. The highest priority is to protect the entire state.
So if it doesn't go ahead, well, then that's it.
Well, look, people were saying this last year, Jeff, about the AFL. You saw what happened there. So, look, I don't want to speculate beyond what's already been commented.
Just back on the Indigenous rates, can you just run through what you're doing to specifically target vaccination for those groups?
It's a good question. Professor Taryn Wiramanthri led the AusMat team in Western New South Wales. Taryn has already briefed. He's back advising us as a contracted specialist. In addition, obviously, with what Aboriginal Health, the West Australian Country Health System, the AMSs, those supplied through GPs and pharmacists, there's plenty of opportunity. But it's very clear out of the New South Wales situation that for some particular communities, we have to try multiple approaches. And Taryn Wiramanthri said they had to go door to door in some of these communities. So Wilcannia was hit hard, but they ended up getting through it. But that is intensive, and this is why I'm answering in this space to say, you know, I'm optimistic that the broad population will be vaccinated, but for some of these communities it's going to be a hard grind, and they will have to be, I expect, locked down, and we will not let people in there unless they're double vaccinated. And people might complain about that, but we have to do it to protect the people literally from themselves.
Commissioner, can I ask just on Cleo, can you just explain the reasoning behind moving the accused man from Carnarvon to Perth?
That's a normal process. When a person is remanded in custody, the person who has been charged over the situation has been remanded in custody for 4 weeks, and he will be transferred to a facility with corrective services.
Is there concern, is it a security issue? Is it a play here?
A person in that situation would not remain in Carnarvon anyway. So the normal process will take place. We'll put extra security measures for obvious reasons.
On the vaccination target, a couple of weeks ago you said that you were quite concerned about that beyond 80%, getting beyond 80%. Has anything changed? Are you feeling any brighter about that for any particular reason?
Look, the way we're tracking, it's already been mentioned, by mid-November we expect that we'll be in a much better position in terms of first dose, and we're only a week or so away from that. By mid-December, we expect again that'll be the point in which further information can be provided. If everyone listened and acted today onwards, there's no reason numerically why we couldn't get 90% by the end of this calendar year. And so we'll adjust, but that would be optimistic, but at the same time it's actually real. People can, and some will be motivated by the mandated, you know, employment regimes, and I saw the same in police. As soon as I made them wear masks, suddenly 20% of them went, I don't like wearing masks. So, you know, some of this is about human behaviour.
So if some people will be motivated by today's announcement, what's your message if we could be actually possible to reach 90 by the end of the year?
It's a broken record. Get vaccinated.
If students come from the regions and those regions to study at university here in Perth, and if those regions have failed to reach that sort of 90% by the late January or so, when their courses begin, will they then have to go online or find alternative venues to study?
I'm certain that, like every sector, they'll adapt. There's lots of online. A lot of students do it online from the regions now, so I'm sure that the industry and the sector will adapt.
The Health Minister singled out younger people. Is it the under 40s who are now holding everyone back?
Look, they are not as well represented as those 40 plus, but yesterday, for instance, we ran 11 vaccine programs for state high schools, so that cohort from 12 years up, which is where our counting eligibility starts from. To have 11 high schools vaccinated yesterday was great, but there's 100 clinics right around the state. There is, I think, a body of people in the 18 plus to 40 who represent a lot of those employment sectors that have to be vaccinated by the end of this month and the end of the year. So you'll see, I think, an uptake where some of these people go. And I've spoken to a couple of them. I was with the Premier at Mirrabooka, and the first man I spoke to said, look, I was always going to get vaccinated, but my boss is making me now.
Chief Health Officer, if everyone's done with the Commission. Dr. Robertson, was it your advice to reopen at 90 instead of 80%?
Yes, it was. And my advice, like all of our advice, will be put up on the website probably later today, I would imagine.
Why is your advice so different to other chief health officers around the country?
We are in a very different position than most other chief health officers around the country. We're not New South Wales, we're not Victoria, we're not ACT. We don't have major outbreaks. So we're one of the few jurisdictions that is actually going to be moving from having no community cases into opening all of our borders, which will obviously lead to the introduction of cases as soon as we do that. And by going to 90%, it's about creating a soft landing, about making sure that we know that we will get cases, we know that we'll end up with hospitalisation, we know that we'll end up with some in ICU and that some will die. But we actually have control to actually reduce all of those factors as much as possible and to push that curve out so that we're looking at 300 days before we actually get the peak. And in those 300 days, there's a lot we can do to make sure that those figures are even lower for our population.
So you're expecting the peak based on that is going to be beyond the winter? Because I imagine there must be some concern about flu and COVID peaking at the same time.
Exactly. So it will, if by getting to 90%, we will be pushing the curve out well beyond our normal winter, and we'll also be flattening that curve so that we won't have the cases. And that will be critical for us. What gets sometimes forgotten, I think, is that every person we put into an ICU is one less person that can go into those ICU beds. So that will impact on other people who have other conditions, who are seriously unwell. So, and what we've seen in the eastern coast is that it has a real impact on the general health of the population, because they can't get the surgery they need, they can't get into the ICUs. So there are a lot of other people who had adverse effects. This will actually give us that soft landing going forward.
When will elective surgeries resume? Is that we've still got a ban on elective surgeries?
No, the elective surgery is continuing as normal at the moment.
So has that returned?
Yes, it has. It was only for a brief period.
So is that not an issue? I mean, you're not. Are you looking at further bans on elective surgery?
No, we're not. So this. Not on the behalf of COVID, and along with the beds that have been announced earlier in the week, the intention is that we will be able to do the business as usual, that our hospitals will be able to continue to operate even when we are getting cases in the community, even when we are getting people hospitalised, but we'll be able to continue our hospitals, be able to deal with all of those other injuries and illnesses at the same time that we are managing the hopefully relatively small number of COVID cases.
I've got two. Is it a coincidence that all the beds that the Health Minister's been announcing for the last few months, I think it's about 530 in total, they won't all be brought on board until October next year, which is about the peak? Is that a coincidence or is that planned?
Look, it's always going to take a period of time to get our beds in place, but obviously part of our planning is it looked at what are the kind of measures we need to have in place to ensure that we can deliver the sort of care that we need for our population.
And the other one was the one I asked earlier. What are the quarantine requirements for people who catch COVID when we're at 90%, and the quarantine requirements for their contacts?
So that is, we are looking at that. It's likely that for that, obviously people who catch COVID, then they'll obviously need to be isolated. If they have the disease, they need to go home and they shouldn't be at work.
2 weeks.
Well, until they get over the disease generally, and usually within 10 to 14 days they'll be over the disease. How we manage casual contacts is likely to change, so there won't be that requirement for quarantine, and we are looking currently at close contacts, and it's likely that we'll move from 14 days to 7 days, and that's being discussed at a national level at the moment. And that will allow us, by not requiring casual, we may still require some testing of casual and close contacts, but that will rely us to better managing any furloughing requirements of staff and things like that. So it is, with 90% vaccination rate, we're a lot more confident that we can do those kind of things.
You mentioned the beds. How crucial is it that we would have the staff that they're aiming to recruit to staff those beds?
So obviously we'll be recruiting staff, and I think that was addressed earlier in the week.
Thanks very much. Thanks very much.